Topic today is going to be posterior mediastinum. And posterior mediastinum, we covered this during the last transmissions. The mediastinum is the space between the lungs. It can be separated into superior and inferior, and the inferior can be separated into anterior, middle, and posterior. So far, we covered the middle, the superior, and of course, with our dissection pathway, the anterior mediastinum. And this is why we reach the last segment of our thorax, which is going to be the posterior mediastinum. The posterior mediastinum actually has, speaking in lay terms, a lot of pipelines, which means a lot of structures that pass from the upper aspect of the thorax to the lower aspect of the thorax and then exit the thorax through the inferior thoracic aperture with their respective openings in the diaphragm. Today in the morning, you heard a beautiful lecture by Dr. Paulina about the basic concept about the central nervous system and then deviating into the sympathetic and parasympathetic nervous system. And those structures that can be visualized in the thorax, we will review and repeat together. Now that we already are familiar with the anatomy of Mr. Skeleton, we know where the posterior mediastinum is, which is going to be slightly exactly anterior to the anterior longitudinal ligament that connects the anterior aspect of the vertebral bodies. We're going to now focus into the anatomy of our male body donor, from which we're very thankful and grateful to be able to learn from. And if we go to the overview, you can appreciate the dissection that we already discussed and I walked you through. Again, here we have the skin, which I'm reflecting into the axilla, the subcutaneous fat, again, I'm reflecting cranially, and on the contralateral side, the full thickness flap. Pectoralis major goes towards the left side. I'm reflecting pectoralis major also on the right side. The anterior thoracic